everyone. So today we're going to talk about how to write notes in your antenatal care record on System 1. So I'm already in a patient's record, test patient. I want you to go to your clinical tree, which is on the left-hand side. And I want you to find your maternal child health section. You may have to scroll down a little bit, but it's there. Under maternal child health, you have an item that says antenatal care record. I want you to do a single left click, which will open your antenatal care record. Here is where you can see all the information about the patient, and you can also write your notes. So the first thing that I recommend that you do is always check out your view history button that can be seen right here. This is where you can view any previous notes taken for the patient. After that, you can scroll down your form and you'll see some things that look familiar to you. So first is your pregnancy details. Here is where you'll have your LMP, your estimated date of delivery, and your gestational age. To add this information, you're going to use this button right beside pregnancy details to add it. When you left click on Add LMP, GA, and EDD, you're going to get a little pop-up that says Record Pregnancy. You don't have to fill out everything here, but what you do need to fill out is date of first contact. So when the person first came to your clinic, I'm going to put the 1st of April. And you can put the date of the last menstrual period if known. If it's not known, you can leave it blank until it's known. But for this example, I'm going to put an LMP of the 1st of March. When I do that, my estimated date of delivery automatically is populated here. The system will also automatically generate a gestational age for you. Then they talk about the method that was used to estimate the delivery date. So you can choose from different options if it's an LMP or an ultrasound scan. You can also put the date of their first antenatal appointment and their folic acid supplementation status, if any. Then you can select OK. Now, as you can see, the information automatically populates in these fields. So you can see the LMP, the estimated date of delivery, and the gestational age. This gestational age will update automatically every time you see the patient, so you don't need to keep re-entering it or recalculating it. Next is your pregnancy history. You can already see I have some documentation here about the patient's gravidity, parity, any spontaneous abortions or induced abortions. If I wanted to add that information, I could select this button that says Add Pregnancy History here. When I left click on that button, I might see some information that I'd already filled out. But if I scroll down, I can see information where I can put in the number of previous spontaneous abortions, the number of previously induced abortions, live births, stillbirths, etc. When I'm finished, I can click OK. Next, we have our lab history. So here's where we put in results for the patient. I've already put in results for test patient here. So I can see her blood group, her hemoglobin level, sickle cell status, VDRL, and her HIV status. I use this button that says Add Laboratory Results to add this information. It takes me to an area called Medical History, and I can just check the boxes that apply for the patient. So here I have ABO blood group, sickle cell status, HB, HIV level, VDRL, etc. Now, something interesting is that I can actually see a trend of the patient's HB. If I right click on the number, I can select graph values, and it will automatically plot a graph for that patient's value here. And so I can see it evolve over time. So let me actually add one now so I can show you. So as you can see here, the HB levels show up. And when I right click and select graph values, I can see the values have been graphed. Below here is our antenatal assessment. So this is our follow-up visits where we tend to put in our assessments for the patient, as well as for our first visit too. So we have our hemoglobin, again, our weights, blood pressure, maternal heart rate, fetal heart rate, fundal height, glucometer, BMI, edema, and other data points that are important. So if you can see here, your hemoglobin is arranged by the latest done. So the 12 was done at the latest, and then the 13 was done before. Same for the weight. You can use your little scroll bar to scroll up and down to see previous values. If I select record assessment, I can update all these fields at one time in this form that's called the follow-up antenatal record. I can put in the patient's urinalysis, their vitals, including their BMI. This information will automatically populate. So let me show you how that works. I'm going to put in a maternal heart rate now. I'm going to select record assessment and put a heart rate of 80 and click OK. And as you can see, my heart rate automatically turns up with the date that I did it. I can also put a fundal height if I'd like, or a glucometer reading. Maybe I'll choose a glucometer reading now. So I can select record assessment, and I'm going to choose a glucometer reading of 5. Click OK, and you can see that it populates here. Now if we scroll down a little further, we can see that we have some notes areas where we can record our presentation or folic acid and pelvic examination. When I select record assessment, I can go to my pelvic examination area. I'm just going to put some example text here. And I can also go to presentation, which I can put cephalic, though this pregnancy might be a little bit young for that. And I can click OK, and that information also will automatically populate here. So hopefully now you're seeing a pattern. In order to see your information here, you can choose this button that says record assessment to enter your information into the template. To view any other information, you can use your view history button to view any other previous information. And you can also use your update appointment status button to mark the patient as finished once you're finished seeing this patient. When you finish writing your notes, it's always important to remember to go to your action bar and save the patient's record here. So just to recap, we covered how to document information surrounding the patient's pregnancy details, their pregnancy history, their lab history, their antenatal assessment, their notes, and their assessment and plan. To see the information, all you need to do is go to your clinical tree and select your antenatal care record. And in order to add new information, you can use the buttons that are beside your headings here. In order to view a more fulsome history of your patient, you can go to your view history button that can be found close to the top of the antenatal care record here in green. Thank you very much for watching.